So we are going to start with this session talking about common elements approaches to support early childhood development. And I think you're going to see a lot of themes that have been common throughout the day. All of today has been about how we can use evidence to inform practice, to support practice, and also vice versa. So you'll see some really interesting interactions in the two presentations that are in this session. I am Sara Baker, and I am a member of the PEDAL team. I'm working in the project that we're going to tell you about, first of all, which is funded by the Nuffield Foundation with the Center for Evidence and Implementation. Would you like to introduce yourself in the centre?
Come in now. So I'm Stephanie Smith. I'm a principal advisor at CEI, or Centre for Evidence and Implementation. For those who haven't come across us and our acronym, we're a global research organisation with offices in Australia and Singapore, as well as UK and Norway. And we are, well, I feel very much amongst friends in this room, which is great because we really do sit between the kind of research and practice gap and try and accelerate that evidence into practice. Set up in 2015, and the UK team is steadily growing, so there's 15 researchers there at the moment. Shall I continue? I think I'm next. I'll keep going. So just to give you a bit of a summary of what we're going to be talking about today. So as Sarah said, we've actually had a really good sort of introduction and grounding throughout this conference so far around common elements and what they are. So I don't think we need to spend lots of time introducing you to those. But what we would really like you to take home today is about considering good implementation and really focusing on that how piece and how the work is supported and scaffolded for practitioners to best introduce them into their work. And we'll also do a very quick walk through the early years library take-up study as well and introduce you to an example or another example on top of golden threads that you've heard about how common elements are being used in PEDAL projects. I'll take us on to our next slide, which just shows a little bit about some of the different phraseology around common elements. Now, all of these things on this slide roughly relate to the same thing and can be used interchangeably. You'll notice golden threads, which has been used before at this conference, also active ingredients I've been hearing smattered about, but essentially they are all looking at the building blocks of what makes up these programs. And the next slide that I show, I usually put this in because I think it's pretty impactful to have a look at the relationship between programs and practice elements. So as you can see in this graph, there's quite a stark difference between the number of programs that continue to come out pretty much at an exponential rate. In this graph, it focuses on behavioural interventions, but we could very well see the same thing across parenting programs, across early years programs as a whole. But the number of practices that are uncovered remains fairly static, and actually over the last 30 years there hasn't been that much new knowledge generated in this area. But in terms of the programs, it's lots of different mixtures coming out and different ways that they're packaged up and branded. So that's something interesting and for us to sort of ponder on in terms of the impact and the implications that has. So what is common elements? So as we've heard today, we don't want to discredit evidence-based programs. They do have a lot of strengths. They are an important part of provision. And we really want to introduce what we're doing as a complement to that. And the two do sit alongside each other as part of the broader kind of ecosystem and offer for children and families. But they do face challenges, and in particular meeting varied needs and changing needs at scale and across different contexts. So common elements approach gets us to really think about what if we identify those specific techniques that are commonly part of evidence-based programs. And from where I'm standing, the really important part is this middle bit. How do we train and support practitioners to use these effectively so that they become part of their everyday practice, they become automated and routine, and we can really accelerate the use of these practices that come from evidence-based programs into more settings. So how do we do that? This is a very simplified set of steps that I've put here. But essentially what we do to identify the common elements and to pick out the building blocks, so perhaps here the yellow blocks from these different towers, is to distill the individual elements looking across a whole variety of sources. So one approach that's been mentioned already is doing a systematic review and very thoroughly, rigorously looking at the literature and what that tells us. But it's important that's done in combination with other things such as stakeholder engagement, and coming back to the programme manuals themselves. You then want to define the elements and essentially set up a tally, have a look and see what are the common things that we're seeing that are cropping up across effective programmes. And then an optional layer is then to make something a bit more tailored and to match elements to a variety of different client characteristics and needs. And to bring this to life, I will pass on to Sarah, who will show how we have done that in our programme.
So thank you. So this is an example, an illustration of how we use the common elements method to synthesize the evidence that's available in the early childhood education space. We conducted a systematic search of the published, so RCTs, we've heard people talk about these a lot today. Here's where they came into our work. We looked at what was out there already, what do we know about effective programs in early childhood education, really across all of the domains of development. We didn't include motor development, but everything else essentially was in there. We then got our hands, I'm skipping over some of the detail here, but we got our hands on the programs that we could, meaning we actually purchased, if we had to pay for them, or we were given by the program developers, the manuals themselves. So those of you who use manuals, sometimes there's like 3 that are each this thick, and sometimes it's less, but anyway, we got the actual manuals that had been used and tested and shown to be effective for improving children's outcomes in those respective areas. And then here's just a few examples you might have heard of that were included in our search. Once we had the manuals, we went through line by line, and again I'm going to skip all of the painstaking coding that was done by the army of research assistants at the time from both the Early Intervention Foundation and PEDAL. This was a previous grant from the Nuffield Foundation. We went through line by line, every line of every manual in the search, in the ones that we obtained, and we then put them all into all these spreadsheets and then just literally looked at them and said, what are the most common things that are happening? What are the practices that these programs have in common? So that's an illustration, okay, of the common elements approach, which you've heard about a few times today. And what that gave rise to in our previous project was this early years library. And it's organized around 3 domains where we had substantial evidence base: early language and literacy, early numeracy, and social and emotional skills, which, if you scan that QR code, you can go to. It's all downloadable, and these booklets sit on a website, which is the current kind of state of the library, and we'll tell you in a minute about what we're trying to do and where the implementation science comes into this, the idea of actually mobilizing that knowledge. So we've done the synthesis of effective programs, and now the question is, okay, how do we get it off of the website and into the hands of the practitioners and then into the lives of those children? I just want to show you one example from the library. This would be the set of common elements for social and emotional skills. And this is just a summary for each one of those. There's a whole booklet, really. This is me energizing myself, running back and forth. Here's your example. So if you go to the library online, you'll see, for instance, recognizing and expressing emotions, which is the skill that you'd be supporting in children. And then it's kind of underneath that thing, which isn't on my screen, so I don't know how to move it for you, but describing how we feel is one of those common practices, those common elements across all the programs. That shouldn't come as much of a surprise to you. A lot of this is like, oh yeah, that's, this isn't really rocket science. These are common for a reason. The most commonly used strategies in the evidence-based manuals are summarized for every one of these practices. some inspiring ideas where we bring it to life, because these are intended for an educator audience, a practitioner audience, and then some of those implementation tips that we could pick out as we went through all of the coding. So that's one page. We have 52 common elements. It's quite a lot of information there, a huge synthesis of the evidence. I'm going to pass back over to Stephanie to talk about what do we do then? It's sitting there, we have these great PDFs, but then what?
Thank you, Sarah. So yes, how do we move from the website and these PDFs to actually something which is done within nursery settings? So it all comes back to implementation, and I'm really sort of glad to see implementation science being talked about so much at this conference. And we wanted to show this slide to show the kind of different layers and different levels of implementation that have been summarised really nicely in Trisha's seminal paper. So looking really at one end of the spectrum, you can have a very passive approach, just sort of let something happen, to something which is a bit more intentional and targeted, to the other end, which I hope is the approach that is becoming more common these days, that's something very active, planned and intentional. And that's what we will be doing in this project. We will be devising tailored implementation plans and guides to really support practitioners to do this well. So not just teaching them about these tools, but how do we scaffold and support and make that as good as can be. So why is implementation important? I could spend ages on this, but I'll just quickly whiz us through. So it matters for outcomes. So the importance of implementation is often really overlooked because we're so focused on the what and so focused on trying to achieve a benefit. And it's also really challenging to implement something new. But what that means in practice is often a lot of evidence-informed interventions don't actually fulfil their potential in real-world settings. So we really need to focus on the how, as well as looking in depth at the barriers and the enablers, those factors that can help or support implementation. So active, effective implementation, we want to really highlight that it's an essential part of this process. It has to be there in order for you to see positive outcomes and benefits and to bring this lovely equation image here to fruition. So I've just listed here a few sort of strategies that could be used to really drive implementation forward and overcome some of the barriers. For those who haven't already read this, there's a fantastic paper by Byron Powell which has summarised over 70 different proven effective implementation strategies that can be used to improve the quality of implementation. I've just put a handful of these on the slide here. I know we have heard about champions and about reminders and nudges and things and various other talks. But it's also important to make sure that you don't just pick these at random. The approach needs to be really tailored and responsive to the local context based on their own barriers and their needs that are identified in an intensive planning phase. I'll pass on to Sarah for the last couple of slides.
Thank you. So now I'm going to tell you again about an illustration of taking the Early Years Library from that set of PDFs, which we developed with the Early Intervention Foundation, to what we're currently doing in the project with the Center for Evidence and Implementation, to get it out there into practice and really see that uptake of that synthesis of the evidence. So this is just a project plan for the grant. We're currently around about here, which means that I don't have a lot of findings yet to share with you, but I can tell you what we've done in the first phase of our work, thinking about some of those strategies that Stephanie has just shown to you. We spent some time just trying to map the practices in settings with nursery managers. So a lot of the key, I think, to the work that we're doing here is about collaboration, not just collaboration with our implementation experts, but collaboration with the professionals in question, those people working in the nursery, and understanding what are the key problems that they face in their practice, and what might be some of the solutions that they could imagine. What are the ways they might imagine accessing a library like this? How would that, solve, make their lives better? But also, what might be some of the obstacles to doing that in the ways that they would like to. So it's first about gathering a lot of that information, mapping the practices, and starting to design some of those resources. Julia, who I think isn't here but is working on this project with us, if you see her, then you can pick her brains about some of the strategies that she's also bringing to bear on the project, like the behavior change wheel and things like that. So we can't go into all of the detail of the frameworks we're using, but I can give you just a little taste of what we're doing in the next phases. We'll be looking at feasibility. So if we gave this kind of resource to settings, would they really use it when they're planning the next steps for individual children, which is one way they might want to use it, or are they more likely to use it for induction of staff? So there's kind of different areas of their practice where we've identified possibilities, but we want to know what actually happens, how much do they use it, are there things that we've prepared that aren't actually supporting them very much, whereas there's other areas where they say, what we really need is we need what we're doing already is we need these beautiful brochures that are very text heavy. We're probably not going to look at that very much, but what we would look at is things on like a key chain, like a key ring. So make a shorter version, short and snappy, that we can pick up and use in the moment, that kind of stuff. And then the next phase will be, once we've looked a couple of times and a couple of cycles of trying it out and seeing how it's actually being used and what the real needs are, then we have the opportunity still within that funding period from the Nuffield Foundation to test the effectiveness. And first of all, the effectiveness there will be in terms of the effect it has on practitioners, because you'd expect first that it changes something about the way they're working, and then eventually it would have an impact on the children. So we'll be asking, does it change their confidence? Does it change their attitudes? Does it change their practice as well? And we're in the early stages of thinking about how we would gather that information, how we would measure that, both qualitatively and quantitatively. So that brings us to the end of our example of using common elements. We'll hear a very different example from Emma in a few moments. Hopefully you can see what it might be like to take a common elements approach to a particular area. In this case, it was early childhood education programs. Earlier you might have heard from Beth and others about other common elements approaches. It's a relatively new way of thinking about using evidence. So RCTs have a place in it, but it's not about doing more RCTs, and it's also not about bringing more packaged programs to people. It's a different way of thinking. So that's why I think it's useful to just go over it again. What actually is the concept behind common elements, and then an example of how you would put it into practice.
And that works. Okay, so I'm going to try and keep the energy up as well as Sarah did, and I definitely don't have any pyrotechnics. So hi everybody, lovely to meet you all. So I'm Emma Cook, I'm a senior clinical lead, and I'm mindful that my actual signature looks like the longest signature in history. But I'm part of the 0 to 19 clinical programs unit, so I sit in the Chief Public Health Directorate within the Global and Public Health Group in the Department of Health, and in the Office for Health Improvement and Disparities within the Department of Health. And I won't go into that again. And I'm here today to just build on some of the theory and methodology that you've heard about common elements and the common elements approach, and just really to share some work that we've been collaborating with, which has been quite an exciting opportunity to think about evidence-informed and emerging evidence, policy and clinical practice, and how we've kind of brought all of those things together in a collaboration with the Start for Life team. So that's what I'm going to talk to you about. Okay, so again, just to sit in context, I think I need to labour that point. But just to say, our focus in the 0 to 9 clinical programmes unit, we work very closely with NHS England and the chief nurse team over there. So we've kind of got lots of interest and work and professional leadership for public health nursing, but also we have a workforce development and thinking about how we can build resilience in the system, but we also have an overarching objective of sharing and increasing evidence-informed parenting strategies. And so part of our portfolio is that our national team, our clinical team, operationalise and deliver the Family Nurse Partnership Programme, which I know Louise referred to in one of her keynote speeches earlier. So that's kind of an evidence manualised programme that we run, and so we've been really, really interested in collaborating with PEDAL and colleagues from CEI in thinking about the emerging evidence for the common elements approaches. Oh, I'm going the wrong way. Okay. So the focus of this work really came from that objective to increase access to evidence-informed approaches for vulnerable families and our ongoing commitment, as I said, to early intervention. And we know that the World Health Organization, we've heard this, lots of things around this today, identifies responsive and caregiving as the most important factor to enable children to thrive and survive. We know that responsive parent-infant interactions reduce the risk of maltreatment and support healthy brain development. And we know that they lay really important foundations for lifelong health and well-being. And I think there's lots of areas of policy that support this and are doing really fantastic work. So it certainly felt today to be like we're in really good company, because I'm hearing lots of the same language used and lots of the same focus and vision, so that's great. So our team became aware of the Common Elements approach, and it aligned, as I said, with some of our own curious conversations about some of the ways of working which we'd experienced in the family nurse partnership model, how we could think about that in terms of increasing that reach without the kind of constraints sometimes of a manualised programme in those contexts where that intensity of work might not be so necessary or needed, but there is something really important about having some kind of targeted offer. So we did a lot of kind of work trying to drill down what's the question that we're trying to answer, and what's the work what would the focus be? So we said, what if we could take the common practice elements from across a range of relevant, well-evidenced programmes to identify the key practices that make a difference? What if we could train a workforce at scale to deliver these practice elements and provide the conditions, so the implementation support? We've heard a lot about the importance of implementation, and that's absolutely integral to how we've designed our modules. How can we enable them to use these elements flexibly to fit families' needs? And what if we enable practitioners to actually draw on their professional judgment? So really listen to them, what's working for them, what's their experiential learning telling us, to help families provide sensitive and responsive care, particularly in those families, as I said, where children are most likely to fall behind. And then what if we collaborate to develop a workable approach to implementing these practice elements at scale? So that was kind of the focus of our work. And quite fortuitously, I'm going the wrong way again. This clicker control is not my forte, it's not my specialist skill. So we kind of started this journey, as I said, we commissioned a scoping review of the evidence from Steph's organisation, so the Centre for Evidence and Implementation, to really look at common elements to support sensitive and responsive caregiving, and really look at what the evidence was saying. I think it was fair to say that there wasn't a lot of, this is emerging, there wasn't a lot of evidence in that 0 to 2 space, which was really the age range that we were focusing on. I think there was one manualised programme from America that was really focused in working with the American military on behavioural support for children. So we were able to kind of have a look at that, but there wasn't anything definitive that we could sort of think, okay. So we started to think about our own experience of our own Family Nurse Partnership Programme, and then we embarked on a really sort of comprehensive stakeholder engagement exercise and process. So we talked to subject matter experts, we talked to people from academia, We talked to families, we talked to workforce, we talked to strategic leaders across the health service and local authority. So we did quite a lot of stakeholder engagement. And we also, through CEI, were fortunate to be introduced to some colleagues working to test a practice elements approach in Victoria in the Australian government. So we had a whole range of very early morning meetings for us and very late night meetings for them to really learn from them. They were a little bit further on in their journey, so really had a great chance to collaborate and consult and say, okay, what were your pitfalls, what were your opportunities, and where was the challenge? Sorry, I've got a really sore throat, my voice is going a little bit, bear with me. And from all of that, and this took place over quite a long time, and it's quite hard to distill into a short space of time, we had our initial development of our proposed practice element modules framework and our high-level theory of change. We then embarked again on a second stakeholder consultation, so consulting with many of the same people that we'd done at the initiation of this process, and kind of said, okay, this is what we've come up with. What do you think to this? What do you think about our modules and our proposals? How do you think these will fit into your local context? Refinements were made to that those initial modules and framework, and our sort of guidance and training materials developed and were signed off from there. And I'm going to share. Yes, so just before I share those, so just thinking about our collaboration, I'm sure many of you will have heard of the Start for Life Family Hubs agenda. I think it was mentioned earlier. It's quite a busy slide, but it's just to give you some context. And where we were able to collaborate with our Start for Life colleagues was on the workforce pilots. So it was a small amount of money, focused on evaluation of workforce innovations and service delivery models that were developed locally in response to local context, and particularly using skill mixed teams, which is, as many of you will be aware, something that we are seeing more and more happening in across public health, but actually there's not a lot of evaluation or a deep understanding of what's being delivered in each of these contexts. So our approach to learning, we kind of approach everything with curiosity. Heard that word used a lot today. The workforce pilots presented an exciting opportunity to test and learn. We know that real life situations and contexts are messy, and they're not always standardised, and they're not always ideal. So we were really keen to understand if this approach could be implemented. So it wasn't a test of concept or a proof of concept about the common elements approach. It was really thinking about, is this going to be implementable locally, and what is the value added of that? So that was kind of the focus. So how the approach can be used by a skill mixed team, how it can be implemented, how practitioners experience using practice elements, and how families experience working with practitioners in that sort of that space. The approach to evaluation, the evaluation is being led by an independent evaluation team. So it's the same team that are evaluating the whole of the Start for Life Family Hub agenda, but there is some specific work, some additional funds that team are able to focus on a practice element piece of the pilot, which is great. And like I say, it's a test and learn approach. Okay, so this slide just sets out our modules. I think, as you've heard, I think Sarah showed a slide earlier about the different ways that common elements or practice elements are spoken about. We talked about practice elements because we really wanted to focus in on practice, the practice of practitioners. And we've split our modules into three. So our module 1, we have called our process elements. So this is all about how to work to engage with families. So all about building relationships, working in a relational way, using the principles of motivational interviewing. So engaging and building relationships, using open questions, affirmations, reflections and summaries, So not just sort of information giving or throwing or hurling, but actually really taking time to understand how has this message landed. Supporting change and goal setting, so action planning with families, remembering that they are the experts in their own lives, what's important to you, and what strategies work for you, and how can we support you to get there. So that was kind of our module 1. Our module 2, which we've called Responding, is to support parents to develop an understanding of and the skills needed to provide sensitive and responsive care for their baby. So again, we have our short-term outcome is that babies receive the sensitive and responsive care they need in the first 2 years of life. And we have split these into 4 modules. So we've got recognising and responding to emotions, so really understanding what's the emotion behind the behaviour that's being presented. Reading and responding to infant cues, so thinking about baby states, cues, and how we really support parents to attune to what their babies are communicating. Focused and joint attention, so supporting them to think about what is it, how are you communicating interest and a shared sort of experience with your baby, and then mindedness and mentalisation. So again, all those things to hold the baby in mind. Our module 3, Developing, was to support parents to provide a safe and stimulating environment. So again, really supporting parents to understand about how to create a safe and developmentally appropriate environment, how they could match care to the baby stage of development, so thinking about kind of scaffolding, learning, and then understanding the benefits of positive caregiver interaction. So how do we affirm success? How do we show interest and convey kind of visual engagement? The foundational principles which underpin this work is working relationally, for sure, using a trauma-informed approach, using evidence-informed approaches which support quality and sustainable change. And as somebody has said already today, we really envisage that this can be delivered alongside other work. It's not a solution or a replacement. It's very much to be worked, to be delivered alongside other interventions. Oops, go backwards again. So our framework for delivery. So this framework illustrates how we envisage this work will work in practice in terms of delegation. So delegated by a health visitor to the skill mix team within that innovative local model. Agreement on the content and the practice elements required to support a specific area of work. We believe we are hopeful, and early findings are suggesting, or early feedback is suggesting, that actually the process elements, the way of communicating, is very much being applied across the piece, which is what we hope. We want that sort of every contact count ethos that the Start for Life agenda has, and actually that all families being in touch with practitioners will receive them in a very similar way. They'll be communicating in a very similar way. We've suggested that they may deliver the practice elements module over 3 to 6 visits, but again, this is very much being tested. We're having very regular touch-ins with the sites, and we're really curious and wanting to learn from them what's working. Are we off the mark with this? You know, is 3 to 6 visits, is that impactful? How are you deciding that, and how are you making those decisions? We hope that that families are able to articulate what they've learned about responsive and sensitive caregiving, and we're hoping that practitioners can articulate the value added of this approach to their practice. And those two things are very much being will be a part of the focus of the evaluation. Just get to the end and then I'll have mastered this clicker. So again, thinking about implementation, we did a lot of initial engagement work with both the Start for Life team and the sites all together to orientate them to the practice elements approach and plans for implementation. We trained all the workforce in the 3 practice elements, So all the skill mix team were involved. So our process elements, so our kind of MI skills, we did face-to-face training. And for our content elements, we did virtual training. We didn't have a key ring with a aid mobile one that Sarah talked about, but we do have some practice guides to accompany all of our modules. And we also have monthly site meetings with all the strategic and clinical leads to update on progress with the Start for Life team. And we also have a peer network 6 weekly meeting to just focus on sharing experiential learning, both with each other, with us, drawing on data and practice insights to really understand what's working and to keep progress on track. These are just an idea of some of the resources. So we've kind of got our practice guides, we've got our 1-minute guides, we've got some key concept guides, we've got a trainer-trainer module, both to support sustainability, because we realised very quickly that recruitment challenges exist in the real world, and actually one of the ways we could overcome them was to kind of support the implementation of clinical leads to be able to train their own staff. So they've got a trainer-trainer module. I think we've got a guide to implementation, and we're also finalising a kind of implementation guide to implementation, if you like, so that people can think about those kind of the kind of processes they need to have in place. Coaching and supervision, they've got a guide to that. We know from our own evidence-based programme the importance of coaching and supervision, skills practice, embedding learning, really consolidating learning and paying attention to that, so to minimise drift. So coaching and supervision is kind of embedded. And for some practitioners, that's the first time that they will have been involved in that kind of approach. So again, our kind of initial feedback is that that's been very well received, as you can imagine. Evaluation. So just to say, the evaluation is being led by an independent evaluation team from Oxford. As I said, they're also conducting the Start for Life team. The focus of this will be around workforce development and how practice elements can be implemented to build resilience. And the evaluation report for this work is expected to be published in autumn 2026. That's it. That is the end. Thank you.